Dr. Beck, in your experience with dealing and working and healing nerves, which we know that we call people a basket case. Usually, their life is in shambles for maybe different reasons. This is maybe but nevertheless, nerves, because to a degree they're invisible. I mean, not for a guy like you or whatever, but they are basically invisible, and they whatever they do, they conduct fluids, they do this, they're the central system of lots of stuff. Have you noticed that or that nerves respond to good or bad nutrition? Are there things you're prescribing people to strengthen their nerves, to make them calmer, to whatever it may be, which then has a domino effect and helps the patients out in many other things?
Well, one thing we see is that nutritional deficiencies can certainly cause nerve damage. I frequently, not frequently, but I see on a regular basis people with vitamin deficiencies, oftentimes from drinking too much alcohol or things like this, that can cause really serious and profound nerve damage throughout their body.
What about drinking too much sodas, Coca-Cola and stuff? Because that stuff apparently, is depleting the body of all kinds of nutrition, so I heard. Maybe it's wrong.
Indirectly, drinking too much sugar can lead to problems with diabetes, and diabetes definitely can cause you major nerve problems.
I see. So what are you recommending people to do? Let's just say, the normal guy who wants to do a little bit prevention, and is there a certain nerve nutrition which you sometimes prescribe people once they already have arthritis or whatever it may be, or carpal tunnel or elbow, Dennis elbow, or back pain and stuff like that?
Well, there's a lot of opinions on supplements for nerve problems. Vitamin B6 used to be given quite frequently for carpal tunnel syndrome. I normally recommend people just take a general multivitamin with minerals as a kind of preventative measure, but there's a lot of question whether taking mega doses of vitamins is actually helpful, and actually in some cases may be harmful, so I don't really recommend that. B6 has not really been shown to be that helpful, but again, I think it's quite appropriate to take a multivitamin just as a preventive measure to make sure you don't have any micro deficiencies of vitamins. Now, in the case if you're an alcoholic, don't have a good diet, you may have profound vitamin deficiencies that can cause severe problems throughout your nervous system. In that case, a doctor's going to really have to check you out, do blood levels, and may even have to give you injections to correct those nutritional deficiencies.
Like IV, put us vitamins in the body in an IV form,
or intramuscular injection. It may take a much more drastic measures to get it fixed.
I see. Okay. And when you do a nerve testing, does the cause of it, such as let's just say that a particular nerve is basically ill, not just pinched. Pinched is one thing, I guess, or whatever, or otherwise squeezed or cut. But let's just say it's basically ill. Would you be able to see that, look, it is severely in need of certain nutritions and stuff like that? Would you see that?
The nerve test doesn't tell us exactly what's causing the damage. This is where being a physician and clinician comes into play. I know that there's nerve damage, and it's my job to sort out why that nerve damage is there. And frequently I'll have to go ahead and order blood tests and do things like that to determine exactly what's going on. For example, could it be a thiamine deficiency or problems with not getting enough minerals or vitamins into your system? That will take additional testing that I have to sort through, usually by blood test.
I see. Okay. All right, so definitely nutritional deficiency does have an aspect in nerves, and should be addressed.
Oh yes, it can cause major problems with your nervous system if nutrition is not adequate.
Okay. Well, once again, Dr. Beck, glad that you are here and tell us all that stuff.